Hi, everybody. Today's topic is going to be methamphetamine psychosis, or what is methamphetamine psychosis. For those of you new to the channel, my name is Dr. B. I'm with Dr. B Addiction Recovery. On this channel, we discuss all things substance abuse. For everybody, if you like our content, please go ahead and subscribe and push the like button. And if you are so inclined, we do have a Patreon and a channel membership for as little as $3 a month. We appreciate the support to continue our efforts. Let's get started with today's question. What is methamphetamine psychosis? I'm going to formulate the question and ask some additional questions. What is methamphetamine psychosis? What is psychosis? How do you diagnose this? And can it be treated and stopped? I have already made a video about this, but there's so much interest in this, and I think it's really important. When you look at the studies, over the last year, over 1 million people in the U.S. have used methamphetamines at some point. Worldwide, that number is over 30 million. Over 40% of methamphetamine users that are chronic at some point will experience methamphetamine psychosis in their lifetime. And a lot of people have a lot of concern about this, especially the users, because they want to know if this is going to go away and if it's going to, or is it going to persist. There is a percentage of people, I don't have that number, I'm not sure if it's really out there, that will have recurrence of psychosis even after they stop using. And there's even a smaller number that will have persistent psychosis once they stop using, and those need to be treated. The first thing I want to point out is, what is psychosis? And psychosis could be secondary to many different syndromes or disease states, including schizophrenia, bipolar, and some other ones. In this case, it's really important to tease out when it's secondary to methamphetamines, and the treatment is really important because unless if you stop the methamphetamine use, the risk of psychosis continues to increase. And with psychosis, now you start to have even much more severe occupational and social issues, and increasing methamphetamine use, which increases your risk for hepatitis C, HIV, run-ins with the law because of the violent behavior. I have with me today Nicole, who many of you know. She's visiting from Arkansas, and I thought this would be a fantastic situation. Nicole has always been open about her history of polysubstance use and abuse, and this is something that she has experienced. So I want to use Nicole as sort of like a little bit of a case example and really delve into what the issue is here and how it should be dealt with. Hi, Nicole. How are you?
I'm doing good.
I want to thank you, first of all, for being open about this and sharing with us. You're not being forced, right?
Oh, no, not at all. I don't mind sharing it all.
Nicole has her own kick-ass channel. She's got a Real Talk Recovery, which is on YouTube. And she also, what is your TikTok?
Real Talk Recover with no Y, because somebody already had that.
And by the way, if you guys want a great community to join that is all-inclusive, medication-assisted treatment or otherwise, go to Nicole's channels. She is awesome and very accessible, and she is a shining light out there in support of recovery with a sober mind. And what I mean by that is she actually knows her limitations, and to the extent that she advises, she's very cautious. I love that about her. Let's get started. Nicole, tell me about your history with methamphetamines and psychosis.
Well, I started using methamphetamine when I was 17 years old, and by the time I was 18, I was using daily. Mid-20s, I started injecting methamphetamine, and after I started injecting, I would stay up for really long periods of time, 3 to 5 days, maybe even more than that. And that's when I started experiencing psychosis, hearing voices, seeing things that weren't really there, paranoia to the point where I would call the police on myself 3 or 4 times, really put myself in a bad position, calling the police, going in and out of the hospitals, leaving AMA. And then finally I got sober in 2015.
Now, when this all first started, were you living at home? Were you married?
I was actually, my parents had kicked me out. They kicked me out about 18 or 19. And so I was kind of just house hopping. I had places to live in between, but I was on my own. I was in a relationship with a guy, but it wasn't like a long-term relationship. We ended up breaking up.
Was there anyone close to you that would have noticed the change in your behavior? And we call this responding to internal stimuli. That means, the voices you're hearing is internal. It's not in the real world. Did anyone notice or point it out?
Absolutely. Like I had friends of mine that would tell me, Nicole, there's nothing there. You're going to be okay. I had my boyfriend that I was living with at the time. He would tell me that, I was tripping and I needed to calm down, that I needed to stop doing meth because I couldn't handle it. But it was just that lack of sleep and just as much drugs. I would put meth and all kinds of drugs in my system and then just really go off the deep end.
So in this initial stage, when let's say you're a family member, mother, father, loved one, husband, wife, you will start noticing this. And usually the user kind of tries to hide it initially before it becomes really apparent and they're open about it, where they'll be like, why are those guys standing behind you? Who are those people over there listening to us? But I don't know how easy it is to pick up if you're not a clinician. I can pick it up pretty quickly because I managed psychiatric ERs for years. But once you notice it, if you notice a person staying up all night, talking outside the window, or you hear them talking to someone in their room, or they go outside and, they're picking up a piece of trash and telling you, I found it. That's psychosis, right? Whether they tell you or not. And I can't tell you how important it is to get into a clinician at that point for multiple reasons. One, to be in psychosis itself is not a healthy state and can cause more disease and more run-ins with the law, hurting themselves and so forth. Two, you're going to perpetuate the methamphetamine use, which itself is a drug that really, really is impulsive and puts you at risk for all kinds of things, including hurting yourself and picking up other infectious diseases like hepatitis C and HIV. So at that point, the best thing to do is acutely the methamphetamine psychosis needs to be treated. And, first line on these are antipsychotics or benzos. But here's the other thing. At that point, also, you need a practitioner because one needs to decipher whether this is methamphetamines or other primary psychotic disorder. And that takes a little bit of teasing out from the history from the patient and the family and the loved ones, and ancillary testing like urine. And there's no reason why you would think that the two things can't be going on at the same time. But it needs to be addressed immediately. You don't just let somebody go when they're having these symptoms. Now, over time, what happened? It progressed and got worse?
Over time, every time I used it got worse and worse. But I never... I would go to sleep and sleep it off. And then when I would wake up, I would almost not know whether what happened was reality or not. It would be so real when I was in those hallucinations that I would wake up and I would swear to God that I just did whatever I thought I was doing, whether I saw somebody from my job or heard someone talking to me. I would sleep and then I would still think it was happening when I woke up, but it wouldn't be happening. But it would be so real when it was happening that I thought it was real. Do you know what I'm saying?
Mm-hmm, of course, yeah. And when you stopped methamphetamines, did all this stop?
Yes.
Yeah. So this is, so a few things on this. Again, up front, the best way to prevent methamphetamine psychosis, which worsens your social, occupational, and amphetamine abuse outcomes if you don't address it, is to decrease methamphetamine use. And the first line is psychosocial intervention, mental health. regular, whether you're in treatment and so forth. And that actually, even if someone is actively using, it shows that if they're engaging in mental health intervention, you decrease the opportunity or the chances of having episodes of methamphetamine psychosis. And that might be something to do with being in that sort of treatment modality keeps you anchored to reality, maybe. But once it occurs, it needs to be addressed quickly. Whether it's antipsychotics or benzodiazepines, don't let it go because it makes the outcome, including treatment retention, worse. Now, Nicole mentioned that once she stopped, the stuff all went away. So we've discussed what needs to be done initially. It needs to be teased out from other primary psychotic disorders. The way to decrease the chances of having a psychotic episode from methamphetamine use is engaging in psychosocial treatment, and that will make all of your outcomes better, including your substance abuse outcome. Now, what about those folks that have recurrence even after they stop using, or persistence? Okay, and I think there's a lot of silent sufferers out there that are dealing with this, and in fact, this may even make it might increase the possibility of relapse, okay? And so what I advise in that case is if that has happened to you, or you have a loved one that deals with that and has persistent or continued voices, paranoia, even long after they've used, you need to get that treated and addressed, okay? Whether it's an antipsychotic or benzodiazepine, you have to discuss that with your practitioner. But I think way too much this issue is not addressed as an attachment to methamphetamine use and abuse. And what it does is it makes the outcomes for the addiction worse, both in terms of social, occupational, and physical, including infectious diseases and persistent use. And one last thing I want to add, which is not discussed often, was talking about methamphetamine. The same issue exists for amphetamine abuse or long-term high-dose amphetamine use. I'm going to get into that on another video, but it's also there. I hope you found this video helpful. If you liked our program, please click the subscribe and like button. And if you are so inclined, please go ahead and use the Patreon to support our endeavors. Nicole, thank you so much.
Thank you.
I think this is very helpful for people, and we'll see you next time.